The following scene could take place at any hospital during morning ward rounds. In this case, the team consists of a medical student, a junior and senior resident, and a staff physician.
We admitted 3 patients overnight. Would you like to hear about them now?
Mm-hmm.
All right.
Mr. Smith is a 66-year-old Caucasian who had a hip replacement 2 weeks ago. He comes in now with a swollen leg and difficulty breathing. We did a blood work and VQ scan, which indicates a high likelihood of a pulmonary embolism, so we started him on an aspirin last night. Unfortunately, this morning he developed profuse GI bleeding, and we had to call in GI to emergently scope him. They are in the OR right now.
Why didn't anyone call me?
We paged you several times.
Well, my pager was on all night. You're lying. I mean, I didn't get any page.
But
anyway, let's get on with it. And if we get sued, it's your fault.
And then there's Mrs. Chen, who is a 79-year-old woman. She came in with chest pain, but it was difficult to get a history from her because she has very limited English.
Oh no, not a case of veterinary medicine, eh? Okay, the emerge doc probably didn't even look at this woman before he referred him to us just because she can't speak English. Why did we admit her? She should have gone to cardiology. And you should know by now how to defer consults to other services.
Mary, why don't you tell us about the 3rd patient? This is actually her room, so we can go see her right after you tell us the story.
Well, just don't stand there. Tell us her story.
Oops, sorry. This is Mrs. Lewis, and she's a 36-year-old female who has a history of bipolar disorder, for which she was previously on lithium. However, she was switched to Epivol 1 month ago for rising creatinines. She also has a history of hypothyroidism, for which she's on Synthroid. She came in with unexplained confusion for 1 day and then an episode of LOC, which resolved. Our investigation showed that she has multiple changes in her blood work, including thrombocytopenia, elevated LFTs, and hyperammonemia.
What was the Epivol level?
Actually, we're not sure. We've ordered it, but I don't remember seeing the result for some reason.
Actually, it wasn't done yet because the patient just came up from ER and we were having a real difficult time getting a vein. So I'm going to go and draw it right now.
Excuses, excuses. It should have been done last night. If I didn't check everything, nothing would ever get done. Nowadays, the staff and trainees just don't have the dedication and work ethic we used to have. We used to be 1 in 2 call and used to live in the hospital when I was in training. You guys have it so easy nowadays. So what are the signs and symptoms of Epivol toxicity?
Confusion probably, and I think they get tremors.
That's right. They also get dizziness, hypertension, arrhythmias, and signs of CNS depression, including LOC. They can also get metabolic abnormalities.
And what is your differential diagnosis for hyperammonemia?
I don't know.
Actually, I was reading a little bit about this last night, and Epivol can cause hyperammonemic encephalopathy.
Why did it take med students to help you answer that question? You need to hit the books rather than goofing off. Anyways, these psych patients, they always have these really weird things with them. It always ends up being an issue with their medication or sometimes even with their psychiatrist.
Actually, I think she's been stable with her bipolar disorder, and she's being followed by her family doctor.
Even better. Hey, Brenda, you're on the family medicine service. We've got a perfect patient to transfer to you. We'll let you GP fix your own messes rather than having us clean it up.
What?
Why don't you get psyched to see them? They are supposed to be specialists and they don't have anything better to do anyways. My residents will tell you the full story. Okay, that's enough teaching on rounds today. And remember, I don't want to hear from you guys until tomorrow unless someone is dying. Okay? I have other really important things to do. And you don't count on graduating from this program until you put in a lot of extra hours.
I think Epival can cause hyperammonemia. You want to know something? If you want to get into a good residency program, you better learn your place in the hierarchy real quickly. You don't just give answers that the residents don't know. It's just not done. You'll never get into a residency program like this one if you act like a know-it-all. You better keep that in mind for future. It's going to be a competitive year for CARMs for our program. If I were you, I would make sure I apply to many programs just in case. I think Epival can cause hyperammonemia.